Hello everybody and welcome to the Tuesday edition of Video Clips. And I want to start a little bit differently. I'm going to get to a couple of announcements, but I first want to say thank you to all of you who have sent suggestions for our little buddy Ringo, Kelly's dog, who's been coming to work here for 12 years. We all love that dog, and any suggestion about his heart condition is really, really welcome. And Kelly is looking into the things that you have suggested to incorporate them into his care. The second thing is I want to talk about some comments that have been posted on this channel pertaining to the diet that we teach. And there are a lot of comments, and some of them are just questions. You know, what do you think about this and that? How do you guys handle a particular thing? And then we get the nasty comments, some of which I can't approve. But we also have two rather polarizing views that I think I want to discuss for a minute, and then I'm going to do something about this that I think might be helpful. So, polarizing view number one on this side of the issue is when people say, oh, this is just more vegan propaganda. Well, we don't teach a vegan diet here, so I'm not sure where that's coming from. It's either you're speaking without knowing what you're talking about, because if you checked it out, you know that that isn't true, or just name calling for the sake of doing it. So that's kind of, we just discount that. It's background noise. I don't care about it. But the other view is the opposite of that, which is hostility, outrage, and disbelief that we don't teach a vegan diet. And the reason is people say, well, if you cared about animals, you wouldn't do that. And it just really being sometimes just befuddled by the whole thing, and then sometimes really hostile about the whole thing. So I want to be clear about something. I personally eat a vegan diet, not because it's medically necessary, but it's because it's a choice I chose to make. But the bigger issue, I think, is that we have big problems here in this country and in westernized countries in terms of health and diet and lifestyle habits and many, many things that need to change. And I think we have got to get smart about this if we are going to make a difference in this whole thing. And what I mean by that is we need a big tent into which we welcome lots of people who are trying to do better for themselves. There is more than one way to eat a health-promoting diet, and when we start, we can, by the way, exclude some. I mean, we're not interested in inviting the paleo and the keto and the carnivore people into our tent. They're trashing the planet and trashing their own bodies and hurting animals. I mean, there's just nothing that can be said that's good about that. But perfection and veganism are not required for health, and ridiculing and marginalizing people who are embracing a different version of a plant-based diet is not going to get us anywhere. What's happening is, in this community, we're turning on each other instead of getting together and making sure that the focus is on the people who are destroying their bodies, the planet, and the lives of animals in the interest of eating animal food as the basis for their diet. So our enemy is not the people who don't eat a vegan diet. Our enemies are big ag, big food, and the promoters of diets that are harmful to humans, animals, and the environment. So I'm going to write an article, an editorial about this, and put it in my newsletter the week after next. So if you're not a subscriber, you might want to decide to become one on that basis. But I think this is something that we have to discuss, is this lack of tolerance in some circles. And you're not going to get anywhere making enemies out of people who want to be your friend. And I'm not talking about me, I'm talking about the community in general. Some tolerance, a deep breath, some tolerance is really needed. So watch for that editorial. I think it's time that we pay attention to this. Couple of quick announcements, and then I'll get to today's topic. If you live near Columbus, driving distance, the Food Over Medicine retreat that we do once a year is Saturday, March 7th. 10 to 4 includes lunch, a delicious lunch, of course. Members for members, it's $30, including lunch. Non-members, $40. And if any of you decide to take the coaching program or the instructor program, you can apply that tuition to the program if you would choose to. And then the Food Over Medicine coaching program, the winter semester version, starts in March. It's live classes via teleconference and some online classes to take, and also a lot of homework to do. And this is so you can start Food Over Medicine chapters, which we're working on something really cool in terms of community health initiatives that will be be led by our chapter leaders. So if something like that sounds interesting to you, send me an email, pampopper@msn.com. And remember, for those of you who are not members who want to earn a certificate for signing the Stop Talking, Start Doing pledge, you have until the end of March. Members get to do this kind of stuff all year round, so you might want to become a member. But if you're not a member, you have until the end of March, and then that's kind of it, okay? Last thing before we get to the topic is, if you're looking for careers, keep those inquiries coming. We can teach people to do a variety of useful things in this field, and we need lots of people, tolerant people, based on what I said earlier, who want to get involved in our business and reach out and help other people. So with that, I want to talk a little bit about celiac disease today. It's an autoimmune disease in which eating even tiny amounts of gluten results in severe damage to the villi in the small intestine that assist with nutrient absorption. This results in the affected person becoming unable to absorb nutrients from food, which, as you can imagine, is a really terrible thing. And it results in conditions ranging from iron deficiency anemia to even gastrointestinal cancer. It's essential that celiac patients eliminate all gluten in the diet, and this includes the obvious sources like gluten-containing grains, but also less obvious sources like condiments, soy sauce, for example, that contain tiny trace amounts of gluten. Even crumbs from a cutting board or a toaster oven can become problematic for the person with celiac disease. Most celiac patients, in my experience, have been made to understand the importance of staying away from gluten, and they're generally really diligent about it. Nonetheless, about 30% of people who follow a strict gluten-free diet continue to have some of the same gastrointestinal problems that they were having before their diagnosis. Because of this, I've always recommended that celiac patients make additional changes to their diet using our eating plan in order to reduce the risk of developing other autoimmune diseases and also other health issues. And just as a side note, people who have one autoimmune disease will often develop several more. They will almost always develop several more if they live long enough. So it's bad enough having celiac disease. What you don't want to be is a celiac patient with Hashimoto's thyroiditis. All right? So we take aggressive steps to try to make sure that doesn't happen. And then I also recommend that celiac patients take probiotics. Well, a new study shows that probiotics do make a difference. In this study, researchers randomly assigned 109 patients with celiac disease who were being very diligent about a gluten-free diet, but continuing to have symptoms they described as being IBS-like. And they were randomly assigned to probiotic or placebo for 6 weeks. And what happened is, without getting into all the details of this percentage and that percentage, they used a couple of different scoring systems to rate symptoms. And on all scoring systems, the celiac patients who were taking the probiotic got better for 6 weeks, and the patients who were taking, the control patients taking the placebo, got worse. The data you can see in the article. If you're a subscriber, you can see these posted in the Health Briefs library shortly after these broadcasts take place. Now, there are some limitations here. This is a small study, limited follow-up time, but the point is that a small study with limited follow-up time that shows pretty spectacular results. For example, one score improved by 15.9% in the probiotic group, worse by 8 points. So you've got a 23-point spread there. So when a small study with short follow-up shows really statistically significant to that extent results, it's something worth paying attention to. And the results make sense because it's established that autoimmune patients have compromised microbiomes, and research shows that they respond positively to supplementation with probiotics. There are quite a few studies in the medical literature showing that autoimmune patients in general benefit from taking probiotics. Now, what we've seen here is that the celiac members who come here avoid gluten. They're very diligent about that. They take probiotics. They eat a health-promoting diet, low in fat, high in fiber, etc. And we see really large and sustained health improvements over long periods of time. So I don't think that this advice is just for celiac patients who are having symptoms. I think it's advice that should be taken by all celiac patients. All right, well, that's all for today. If you are not a subscriber, hit the subscriber button. And if you know somebody who would benefit from seeing this, please feel free to pass it on. And then I'll be back to you on Thursday with more news.